are different options for hip replacement. There is a hip resurfacing, which involves just removing the surface of the femoral head and the acetabulum and replacing that with metal. There is no hard evidence right now that is better than a traditional hip replacement where a metal stem is placed inside the femur and a little bit more bone is removed. The two, obviously there are people on both sides of the fence, but those are both options, and both involve a similar sized incision, and really pain relief is pretty equal between the two. There are different options as well for traditional hip replacement, and there is one that's been in the news a lot lately, and that's the metal-on-metal hip. And that just means that the acetabulum is metal and the femur is metal, or the ball and socket are both metal. And the reason that's been in the news a lot is that we've seen that can increase the metal ion concentration inside of our bloodstream. One disadvantage of the metal-on-metal hip is that over time the metals can wear and you get breakdown of the metal and ions that concentrate in the bloodstream. So what we found is that sort of hip replacement is not a good option for some people, especially women of childbearing age. But there are several other options that are still very good options, and one of those is the metal-on-plastic hip, and then there is also metal-on-ceramic. Although there's been a lot of media attention on the metal-on-metal hip, there are also still good options for hip replacement. There are very important things to do to prevent arthritis within the hip. Eating healthy is a very important thing for nutrition in the joint and for weight loss. Weight loss is very important because 2 to 3 times the body weight is transferred across the hip joint with each step, and that goes up exponentially with high-impact exercises like running. So a weight loss of 5 pounds results in 15 pounds of reduced stress across the hip joint. There are a lot of treatment options for people with hip arthritis that don't involve surgery. I always like to begin with physical therapy to increase range of motion and function across the hip. I think if we can keep the muscles strong, that reduces a lot of the stress across the joint. We also use anti-inflammatories to reduce the hip pain and inflammation within the hip that results from arthritis. Another option for patients who have arthritis in the hip, before we talk about surgery, be it arthroscopy or arthroplasty, is to have an intra-articular injection. And we do that under live x-ray. We're actually able to insert the needle into the hip joint, and we inject a little dye at that point to make sure we're in the joint, and then we inject a steroid with some local anesthetic that gives a patient relief from their hip pain and from the inflammation that's occurring. For people considering hip replacement, I guess I would tell them that yes, it's a big surgery that has risks, but when you're to that point where each step hurts, I can tell you that I've had so many patients who have thanked me for a new life because they're now able to walk without pain. And you know, I've had several young patients even recently who had that terrible bone-on-bone arthritis and had thought that they would never get relief or have a normal life again. And one gentleman recently came in and was walking several miles a day just 6 weeks after surgery and doing great and ready to go back to fly fishing, and those are the kinds of things that make it very gratifying for me. So. We came to Brigham City because we came here for an interview and just immediately enjoyed the people. We loved the small town feel and just felt like it was a great place to raise a family. It's a very family-oriented community. And one thing that I really appreciated is that people here are active. They like the outdoors, they like to mountain bike, they ride their ATVs, they ski, they snowboard, and they just enjoy the outdoors, and that was one thing that really appealed to me. And I thought, you know, that this was a population of people that I would enjoy keeping active and helping to get over injuries and get back to activity.